Hello, good morning. I am Dr. Cruz. You must be Samantha Santiago. How do you want me to call you?
Sam would be okay.
And you are with?
I'm Mrs. Santiago.
Good morning. Please have a seat.
Thank you.
How are you today?
Good.
Okay. I use a different format for my adolescent patients.
Right.
To get the best out of this interview, what I will do is, kakausapin ko muna kayong magkasama to verify some points. And then after that, si Sam muna yung kakausapin ko. And after, tayo na ulit tatlo. Okay? Is that okay with both of you?
All right.
Now, let me assure you that everything that we talk about in this interview will be strictly confidential. Do you understand what confidential means, Sam?
Opo. Ibig sabihin secret.
Okay, yes, that is correct. But there are certain situations that I have to break confidentiality. Tulad ng one, if you begin to hurt yourself or you hurt others. Two, if you are a victim of drug abuse or whatever abuse, or if you have an activity that I feel baka nasa danger ka. Okay? So these are situations na I have to break confidentiality. So, Ms. Santiago, let me assure you na kung kailangan i-notify ka, gagawin ko yun.
Salamat, Doc.
Okay lang, Sam?
Okay po.
So, Sam, you are here because you have a problem with your menstruation? So, tell me about this problem.
My period has always been irregular. Minsan po, nagsiskip siya for months. Tapos minsan naglalast for more than a week.
It says in your record that you started your menstruation at 11 years old and merong pain during mens. On a scale of 0 to 5, 5 being the worst pain, pinakamasakit during your menses, and 0 having no pain, gaano kasakit yung menstruation mo?
Mga 3 to 4 po. But when I take mefenamic acid, nawawala po yung pain.
So, Mrs. Santiago, since you're here, meron ka bang concern na pwedeng
Well, now that you bring it up, I think she's overweight. Yes. She's been eating a lot lately. Tapos laging nagkukulong sa kwarto.
Sam, are you concerned about your weight?
Not at all.
Alam mo, ang problema mo, hindi ka nakikinig. Sinabi ko na yan, Doc. Nagkukulong sa kwarto. Laro ng computer, nanonood ng TV. Wala siyang activities. I told her to get exercise. Can you please talk to her, doctor? May hindi siya nakikinig sa akin. And one more thing, I think she smoked.
Ma!
So, aside from the weight problem and inactivity, are there any other concerns, ma'am?
I think she hasn't been sleeping well lately.
Oh, I see. Well, any other concern aside from that?
Wala naman na.
So, I will talk to Sam alone now, ma'am, and then later, I will call you again. I will ask my secretary to usher you out and
Alright.
to sign some of the forms outside.
Okay.
Thank you.
Thank you.
Well, Sam, okay, I will be asking some questions na very important, okay, para ma-assess ko yung sitwasyon mo. So, you may or may not answer these questions, pero I suggest you answer them truthfully para naman ma-assess ko yung sitwasyon natin. Okay? Again, remind ko lang, everything is strictly confidential, except for situations na sinabi ko kanina. Is that okay?
Okay po.
So, what can you say about your mom's concerns?
I know I'm a bit overweight. Pero siya din kaya.
So, you mean to say you're not concerned about your weight?
Konti po. Pag nakaka-depress pag ginagawang joke ng lahat.
Who jokes? Sinong nagjo-joke nun?
Well, yung family ko tsaka yung mga kaibigan ko.
Okay, speaking of your family, can you tell me about them?
Well, we're okay.
Okay, meaning?
We have very minor problems.
Alright. So, can you describe yung relationship with your mom and your dad?
We're close. We're like friends. Pero mas close ako sa mami ko. Kasi yung daddy ko, he's always busy with work. Tapos, he's into computers kasi. Tapos, he's always out of the country.
So, you mean to say kung meron kang mga problems, you talk to your mom?
Not all the time po, kasi medyo conservative yung mami ko.
Oh, ganun ba? Okay, so what about yung mga siblings mo? Ilan ba sila?
I have 2 brothers. Yung younger brother ko, he's 9 years old. Tapos yung youngest brother ko is 7 years old. We play, we have fun together, pero they're still young.
So you said kanina na you could not really talk to your mom about certain problems. So who do you talk to?
Friends.
Friends. Okay. So your friends are in school?
Apo, they're my classmates.
Are your friends boys or girls?
Both lalaki at saka babae.
I see. You're in college, right?
Apo, first year.
Okay. So how is it? Is it easy or hard?
Both easy and hard.
What do you find easy? What do you find hard?
Well, actually, I love my course, fine arts.
Okay.
I love going to school and I love my course, but at the same time, I have enough time to have fun, so I guess I'm okay.
Okay. What about your grades? Okay ba? Passing? Average?
Above average.
Whoa, very good. What about your classmates? Are they failing?
Some are.
Are they into smoking or drinking alcohol?
Yung iba po.
What about you?
I smoke. Minsan po nakakaubos ako ng 5 to 6 cigarettes. Sticks of cigarettes. Pero depende po kung natetense ako. Pero I don't drink alcohol.
What about drugs? Marijuana, shabu?
Dok, ano ba? Hindi kami nagaganon.
Okay, very good, Iha. Well, are you going out or steadily dating someone, a boy or a girl?
You mean a boyfriend?
Yeah, do you have a boyfriend?
Yes, I have a boyfriend.
So, where did you meet your boyfriend?
In a party. We're together for almost 4 months now.
So, is he your first boyfriend? How old is he?
Yes, my first boyfriend, he's 19 years old.
So, is he still in school?
Apo, he's in 3rd year.
Okay. So, how far have you gone with your boyfriend? Have you had sex with him?
Yes?
Did you ever use protection like condoms?
No po. Pero once lang yun. After that, wala na.
So, do you think you're pregnant?
No, but I really got scared after we did it 3 months ago.
When was your last menstruation? And for how long?
I had my last menstrual period 2 weeks ago, and I had it for 4 days, like the usual.
So, I gather you're not having sex anymore.
No, even if he keeps on forcing me to do it, I won't, because takot talaga ako.
Okay, so since the last time that you had sex with your boyfriend, did you notice any discharges coming from your vagina? Pain or fever?
None po. Once lang yun, Doc. Wala na, hindi na nangyari.
Ano ang pakiramdam ng boyfriend mo now that you're not having sex?
Well, he's not happy about it, I guess. Tapos nakikita siya ng friends ko na may ibang kasama sa school, may ibang kasamang girls. And I think he's avoiding me.
Okay. Anong pakiramdam mo?
Siyempre, nakakainis, tsaka nakakalungkot, pero I don't really care.
So what do you do pag ganito yung nakaramdaman mo?
Makain ako ng tsokolate. Tapos okay na.
Have you ever felt, sa buhay mo yung you're really, really sad and that you just wanted to end everything?
Nalulungkot po ako, tsaka naiinis, pero I haven't really thought of hurting myself.
Your mother mentioned, diba, na you weren't sleeping daw at night. Is it because of your boyfriend?
Yes. I tried taking sleeping pills na binigay ng friends ko, and it helped sometimes. Pero I think I sleep better now.
But now, do you plan to take more sleeping pills?
Pag sinabi niyo pong bawal, hindi na.
Okay. And then may sabi pa yung mommy mo kanina about you're spending too much time sa TV, sa computers. Tama ba yun?
Wala naman po kasing ibang gagawin.
How about sports or any other hobby?
Dati po, ay nagbabike ako, pero ngayon hindi na.
Okay.
Mas masarap makinig sa iPad, tas I think things through.
Well, if there's anything that you want to change in your life, Sam, ano yun?
I hope I could be thinner. Para pag nakita ko yung boyfriend ko, habul-habulin niya ako, mag-regret siya dyan.
Well, thank you, Sam, for your honesty. I know some of the questions are really very difficult, pero nasagot naman natin. So now, I will make my physical examination. I will tell you what I will do as we go along, and then I'll ask my assistant to help me out. Okay?
Okay po.
Then after that, we will talk about what we will do and what we will be telling your mom. All right?
Alright.
Okay, Sam? So, based on what we talked about, well, I commend you for your dedication with your schoolwork, okay, for getting good grades, for being okay with your family, and for trying to get out of trouble, okay? Now, I gathered that these are your concerns. One, you're being a bit overweight because of your inactivity and your poor eating habits. Secondly, you had unprotected sex with your boyfriend, but I'm really happy that you are practicing secondary abstinence, okay? Thirdly, you are smoking. It is not a problem now, but, you know, it may be a problem in the future. And then, lastly, is you cannot sleep well at night. Do you agree?
I guess you're correct, Doc.
Okay, so I will run some tests regarding these, okay? Okay, so gusto mo bang discuss tong screening test mo with your mom?
No po, she doesn't know eh.
Okay. So you are responsible to do this screening test as soon as possible, huh? If you need my help, I can give you referrals, request forms, okay? And on follow-up, we can talk about the results. You can show them all to me. And I suggest you refrain from any sexual encounter until we get the results. Okay? And then we can talk about it after. Can you do that?
Okay po, I'll do it myself. Thank you.
Okay, so now I will call in your mom so we can talk about these tests, especially regarding your being a bit overweight. All right? Okay, Sam, is everything okay?
Apo.
Do you understand what we did? Okay ka naman?
Okay po.
Okay. I'll call in your mother, huh? Lisa, can you ask Mrs. Santiago to come in? Okay. Okay ka lang ba? Now it's time to talk to your mom, huh? Okay. Hello.
Hello. Yan.
Okay. Na-examine ko na si Sam. Okay? And then I have certain issues to talk about with you.
Alright.
And then, siguro importante din kasi for her health yung update ng kanyang immunizations. Sam, there is this new vaccine for teenagers that will help prevent cervical cancer caused by a virus called HPV. HPV stands for human papilloma virus. Okay? It's just a normal, like a normal flu shot that you get every year.
Talaga po. Paano po nape-prevent yung cervical cancer?
Well, the vaccine is against some forms of HPV, which are the most common causes of cervical cancer in almost 70% of all its cases. Now, studies have shown that if you are given this vaccine at this age, it will be more effective and it will protect you until adulthood.
Baka naman masyado pa siyang bata, Dok.
Actually, this is the best time kung saan yung immune system niya talagang mas high as compared kung mas matanda pa siya.
Hindi kaya masyadong mahal yan, Dok? Baka masyadong mahal.
Sabihin na natin medyo expensive, pero kung titingnan mo yung benefits, it's just a small price to pay, di ba? To guard her against cervical cancer.
Dok, hindi ba masakit yan?
Meron konting pain, pero tolerable yun. Mawala din yun after 1 or 2 days. Any other question?
Wala na po.
Ma'am, do you have any more questions?
None at the moment.
Okay, so thank you, Sam, for your cooperation. I'm really glad that you came in today. I'll see you again next time.